And we begin with the latest twist in the Dr. Gosy saga. Univera has become the latest healthcare provider to cut ties, at least temporarily, with the doctor from Clarence. Univera has suspended Dr. Gosy from participating with the company. Next up, a hearing to decide whether to drop Dr. Gosy and his entire Williamsville office from its coverage for good.
Now, just yesterday, 7 Eyewitness News was first to tell you that both Independent Health and Blue Cross Blue Shield of Western New York had dropped Dr. Gosy from their network. Independent Health, though, will still cover other doctors in Dr. Gosy's pain management clinic. Blue Cross Blue Shield will not.
Since the indictment and closure of Dr. Gosy's office, we have heard from a number of patients who say they're frustrated. Primary care doctors are turning them away.
Well, now, as 7 Eyewitness News reporter Ed Riley tells us tonight, more and more people are running out of their pills and they're rushing to emergency rooms, afraid of going into withdrawal.
We've seen an increase of 2 to 3 times the number of patients presenting with these type requests to our emergency rooms.
Dr. Brian Darcy, Senior Vice President of Medical Affairs for Catholic Health, says all the Catholic hospitals have seen a big increase in emergency room visits after the closing of Dr. Gosy's office.
Very often it's a sense of marked anxiety and fear on the part of the patients relative to the symptoms that they will have if their pain syndrome returns.
Worried patients are telling emergency room staff that they're being turned down by other providers and primary care doctors who refuse to help them with pain management.
You really cannot, in the emergency room situation, be dealing with long-term prescriptions and the medications we give.
Catholic Health is keeping track of the situation, but emergency rooms cannot take over all the duties of pain management. And so after evaluations, if it's determined that a patient needs pain medication, only a short supply, usually 3 days, can be provided.
It's almost impossible to meet the patient's expectations for chronic management of their pain.
Contrary to misconceptions that only addicts are complaining, Dr. Darcy says Catholic Health is seeing people from all walks of life and from many different age groups.
Very many of these patients have truly legitimate chronic pain syndromes associated with significant medical diseases, oftentimes a malignancy or a cancer or a rheumatologic disease, an arthritis type disease.
We asked the doctor if he expects the situation to get even worse now that Blue Cross Blue Shield dropped Dr. Gosy and his physicians, and Independent Health announced Dr. Gosy is no longer affiliated with its network.
It depends on whether or not there are going to be alternative sites for legitimate prescribing of these medications, or the other physicians in that practice being able to resume care for many of these patients.
But that is the big question. Dr. Gosy's website says his office will resume seeing patients next week. But with the recent developments concerning insurance coverage, some wonder if that will actually happen. And the situation is such a concern that the Erie County Medical Society is now in contact with the New York State Health Department and the Office of Professional Medical Conduct. And they're hoping to find some sort of solution to this crisis.
And do you see an end in sight at all into this?
You know, I asked the doctor that today, and he says no, he doesn't even think we've seen the worst of it yet. And that's really for 2 reasons. One, there's still a lot of people out there who have not run out of their pain pills yet, and there is just a terrible shortage of pain management doctors here in Western New York.
Who would have ever imagined that the actions of one doctor or one doctor's office would affect so many people and affect the entire community?
Yeah, it's almost unbelievable when you look at this whole story, Keith.
All right, thanks, Ed.